Hello, my pen supporter. Hello, my pen supporter. Welcome to medical science class. As a student of medical science, I wanted to take flavor every branch of science. What kind of things say do that is that is knowledge, that is this, and that is what there is in. As a Muslim, Allah is the one and make you accept Allah. This must be. Ya Alif Lam Dama, Ya Allah Shafi, Ya Allah Mafi, Ya Allah Kafi. Ana Abdul Muhammad Soy Shafi Mafi Kafi. Ana Shafi Alamba, Ana Shafi Alamba. Now my pen supporter. Those are my patients. We elaborated about diarrhea. Diarrhea. What is diarrhea? Passing of stool per day more than 3 times. That is diarrhea. Considered as a diarrhea. Now diarrhea, what diarrhea occurs? Bacteria like salmonella. Bacteria like what diarrhea occurs? Salmonella, Shigella, and bacteria like salmonella, Shigella, and virus like rotavirus, and parasite like giardiasis. And in case of salmonella, Shigella, passing of the stool, patient symptom, stool passing. The treatment is oral rehydration solution. Oral rehydration, ORS, oral rehydration solution, saline. Now those are my patient in your home. If saline is not available by salt, you can make saline and take that. Now for saline, half liter, how much salt and how much sugar or sweet necessary. Combine that. Then why sugar? From sugar we found glucose. In air, oxygen, glucose, or ATP, cell ATP. Body will or not weak. Those are suffer the diarrhea, common disease. In case of diarrhea, passing the water reduce and salt also reduce. That is the reason sodium chloride. In cell fuel, also food not utilized. That is the reason go to the gut to stool not utilize body cell blood. That is the reason give to glucose. In glucose and in saline utilize sugar, sucrose, fructose. From sucrose, fructose we found glucose and saline. Orally. If orally not possible, then IV. In case of cholera, IV we give nutrition supply, glucose and sodium chloride solution. In case of diarrhea, what happened? Salmonella Shigella, the treatment is, what is the treatment? Antibiotic. But in case of Salmonella Shigella, that is antibiotic. What antibiotic? Any antibiotic, but amoxicillin. For children, amoxicillin. I give the choice, amoxicillin and ancillin dose. In case of adult, ciprofloxacin, adult dose. Now diarrhea. And in case of, what is diarrhea? Dysentery. In case of dysentery, bacillus dysentery, amoebic dysentery. In case of bacillus dysentery, occur by bacteria. What bacteria? Salmonella Shigella. In that Salmonella Shigella or other bacteria, Salmonella Shigella, bacillus dysentery occur maximum. Then what happens? The treatment of choice, antibiotic. In antibiotic, that is oral route, ciprofloxacin. In IV route, antibiotic. And I give the treatment of choice, ciprofloxacin. Oral route is take, then no need IV route. If oral route not take and passing to the stool, then IV route. Now Vibrio cholera. In cholera, cholera saline. Also antibiotic. Vibrio cholera. Ciprofloxacin is the. I give the ciprofloxacin. Now rotavirus. In case of rotavirus, what is the treatment of soil? Choice. ORS, so common diarrhea, oral dehydrated solution. And in case of children, rotavirus occur in children, not adult. You give the treatment of choice, antiviral. Sometimes if diarrhea is severe, then you know that give the steroid. Sometimes diarrhea is severe diarrhea, not occur by antibiotic, not correct by antibiotic. Then steroid in given in that diarrhea. Okay, fine. And steroid given. Steroid solution given. Okay, fine. That depend on professor, not without consent of professor. In cholera hospital in Bangladesh, give the antibiotic as per I know by my professor, internal, external in medical science. They say in cholera hospital give steroid or stop diarrhea, severe diarrhea, especially BP quality with the professor consent. Now dysentery. In case of dysentery, bacillary dysentery and amoebic dysentery, namaskar, Bangla, in Bengali. Bacillary dysentery is the treatment of SOS, ciprofloxacin, oral route. If drug remain 30 minutes, not pass to the stool. If not remain, give the IV saline, ciprofloxacin. Those have not ciprofloxacin sensitivity. Now, in case of amoebic dysentery, how you understand the bacillary? Amoebic dysentery is copious, and blood come to bacillary dysentery also amoebic dysentery. But rough and tough situation, when rough and tough situation equal more or less 2 or 3 days, then come blood. In bacillary dysentery, amoebic dysentery. In bacillary dysentery, treatment of choice, difference, amoebic dysentery. In amoebic dysentery, the pain around the navel side. The pain around the navel side. And bacillary dysentery, that is the pain in abdomen. And amoebic dysentery, passing of the stool, amoebic dysentery, less amount. But bacillary dysentery, passing of the stool more. Amoebic dysentery is copious. Amoebic dysentery, treatment of choice, metronidazole, 400 mg 3 times. In bacillary dysentery, ciprofloxacin. Those patients have no ciprofloxacin sensitive. Ciprofloxacin 500 mg 2 times. If drug remain abdomen, no stool pass in 30 minutes. If stool pass, then give to IV route. Diarrhea, that is the Salmonella Shigella. Now we go to the diarrhea for other purpose. What other purpose? Just like om. If om occur and om like big om or small om, for understanding purpose. Big om, the treatment of SOS, albendazole. Small om, the treatment of SOS, mebendazole. Small om like teichuria, that is teichuria small om, for understanding purpose, mebendazole. Big om, albendazole. And 3 consecutive days, adult dose. Okay, fine. Also children suffer the om. You know that in om case, you see the stool, patient say that I see the om in my stool. Okay, fine. And by that history you confirm there is a om occur and parasitic disease. Now my friend Sabuda, today is enough for diarrhea and the treatment of diarrhea we discuss elaborated about that. And today is enough for medical science class, and thank you very much. And in case of diarrhea patient, why die? The patient white die, the blood volume, adult human need 2/3 liquid, 1/3 solid portion. If blood plasma reduce, you know that if blood plasma reduce, stool reduce, sodium chloride reduce, what happens? Hot shock develop, hypovolemic shock. In hypovolemic shock controlled by volume, normal saline. Sometimes severe case, normal saline. Volume is replacement by normal saline, IV saline. If hypovolemic shock in diarrhea occur, the treatment is shock managed by normal saline, 0.9% sodium chloride solution. If correction of hypovolemic shock. Sometimes patient remain in shock if the hypovolemic in diarrhea, 0.9% sodium chloride solution is the treatment of choice of hypovolemic shock. Those patients, how you understand the shock, symptom of shock? Pulse rate, body tachycardia, then bradycardia, and pulse reduce, pressure reduce below the 40. First pressure reduce below the 40, and cold clammy skin, tachypnea, breathlessness increase, and eye go to the deeper side, sign of hypovolemic shock. Also dehydration, thirst feel. that is the sign of hypovolemic shock. Now hypovolemic shock is correct by 0.9% sodium chloride solution. Also oxygen is available. Also give the glucose, 5% DA. If patient have no diabetes, non-diabetic patient. How you know that non-diabetic? See the history of diabetes. Otherwise, do the routine examination, and also RBS, random blood sugar. You see. If diabetic patient, you give glucose, what happens? Hyperglycemia occur. That is the reason. Thank you very much, my friend supporter. Today is enough from medical science class. I am representative of Dr. Mohammad Sohel.